At our practice, we are often explaining to our patients the difference between a porcelain onlay, a porcelain filling, and a crown, which is often commonly known as a cap as well. Over to you, Katie.
So we're going to make a video about this because I'm fed up with trying to explain this. So historically, if your tooth was too damaged to restore with a filling, you would have a crown. So a crown is almost like a cap or a hat that sits all the way around the tooth and that goes all the way down to the gum line. It requires quite an extensive preparation on the tooth, but historically it was necessary to do that for the crown to have enough grip on the tooth for it to stay on. Over the last few decades, bonding has really improved in dentistry, and so you don't need that physical grip all the time to retain the porcelain restoration to your tooth, and which means that you can have a different type of restoration called an onlay or an overlay. They're similar things. An onlay or an overlay essentially sits on top of the remaining part of the tooth. It doesn't need to go all the way around it, so you can prepare less of the tooth, and the rim of the tooth close to the gum line is an important part of the tooth to keep because it keeps it nice and strong. So a porcelain onlay sits on top of the tooth. There is less preparation. The preparation is defect driven, so there's less to do. You just take away the bits of the tooth that are damaged and you restore what's left, and the restoration holds in place by being bonded to the tooth. It's important that if you are bonding to the tooth rather than gripping to the tooth, that you are really good at bonding so that you have good isolation. So that's the difference between a porcelain onlay and a crown.
Very good.